Hey, you guys, welcome to Pass MA with Danny. Are you ready to crush the CCMA exam? I know that studying for this test can feel a bit overwhelming, but I don't want you guys to worry because you're definitely not in this alone. In today's video, we're going to tackle 35 must-know CCMA questions. And I'm not just going to give you the answers, I'm going to break down why each answer is correct with detailed explanations so that you can actually understand the material. So go ahead, grab a notebook, get comfortable, and let's put your knowledge to the test. I want you to try and answer as many questions as you can. And at the end, drop your score in the comments. I want to see how you guys do. All right, you guys, let's go ahead and jump in. Question 1. A medical assistant is preparing a patient for wearing a Holter monitor. Which of the following instructions should the assistant include? A. You will be required to wear the monitor for 2 to 4 hours. B. You should avoid your regular exercise routine during monitoring. C. You should avoid using an electric blanket during monitoring. Or D. You can bathe and shower as usual during monitoring. I'll give you a second. All right, if you said C, you should avoid using an electric blanket during monitoring, then you are absolutely correct. Remember that our patients wear those Holter monitors home. They wear them for a minimum of 24 hours. And we don't want patients to avoid doing their regular exercise. We want them to maintain their regular activity so the provider can see how their heart is functioning under their day-to-day activities. And then again, remember, that Holter monitor is an electrical device. We do not want the patients to get them wet. We don't want them to bathe, take a shower, go swimming, jump into a lake. We want them to keep them as dry as possible. Now, it is very important for the patient to avoid using an electric blanket during monitoring. Why is this? Because devices such as electric blankets, heating pads, microwaves, and even other household electronics actually do generate electromagnetic fields. And this can disrupt the electrical signals that are recorded by the Holter monitor, which in turn can produce a false ECG reading. All right, you guys, question number 2. What is a yeast infection of the mouth? Is it A, anthrax, B, thrush, C, rubella, or is it D, candidiasis? And I'll give you a second. If you guys said B, thrush, then you are absolutely correct. Thrush is a yeast infection of the mouth that's caused by an overgrowth of fungus that is generally found throughout our body. And we see thrush occur most commonly in infants, patients who are immunocompromised, and also those who are using corticosteroids or even antibiotics. Now, some symptoms that are commonly seen with thrush are white creamy lesions on the patient's tongue, throughout their inner cheeks, and even in their throat. Patients may experience pain or discomfort while eating or swallowing, and they can also get cracking or redness around the corners of their mouths. We treat thrush by utilizing antifungal medications. All right, you guys, question number 3. A medical assistant is reviewing the lab results of a patient who has the Epstein-Barr virus. The assistant should identify that this microorganism can cause which of the following conditions? A, polio, B, mononucleosis, C, gastroenteritis, or D, fifth disease. I'll give you a second. All right, if you said B, mononucleosis, then you are correct. Mononucleosis is also known as mono, and it's caused by the Epstein-Barr virus, and we call this EBV for abbreviation. Now, EBV spreads through saliva, and this is where mono had received its name, the kissing disease, from, because you can contract this through kissing, drinking after someone, and also eating after someone. Some symptoms that patients experience with mononucleosis are extreme fatigue, sore throat, swollen lymph nodes, enlarged spleen or liver, and also fever and body aches. Question 4. Which of the following words describes an immune system that is weakened or not functioning properly? Is this A, coordinated, B, combined, C, compromised, or D, complemented? If you said C, compromised, then you are correct. A compromised immune system means that the body's defense mechanisms are weakened or they're not functioning properly. And this can actually make a person more vulnerable to infections and also diseases. Next question, question 5. Which of the following is outside of a medical assistant's scope of practice? A, to perform clinical duties under the direct supervision of the provider. B, order additional laboratory tests to confirm the patient's condition. C, provide directions to a patient about preparation for a diagnostic test. Or D, to reinforce instructions about medications and special diets. If you said B, order additional laboratory tests to confirm the patient's condition, then you are correct. Now, medical assistants are not licensed to order tests or make any independent medical decisions. Only licensed providers like physicians, nurse practitioners, or even PAs, physician assistants, can order additional lab tests based on their clinical findings. Now, medical assistants can collect specimens, they can process lab orders from providers, and also communicate test preparation instructions, but cannot initiate or modify lab orders. Question 6. A medical assistant is monitoring a patient during a stress test. The patient becomes increasingly short of breath and tachycardic. Abnormalities appear in his EKG rhythm. Which of the following actions should the assistant take first? A, discontinue the test. B, instruct the patient to take slow, deep breaths. C, ask the patient if they're experiencing chest pain. Or D, obtain the patient's vital signs. Okay, if you said A, to discontinue the test, you are correct. Now, the first priority in a stress test is going to be patient safety. Signs of distress that a patient may experience could be shortness of breath, tachycardia, abnormal EKG rhythms. This could possibly indicate a potential cardiac event and requires immediate termination of the test. If we were to continue the test, we could actually worsen the patient's condition. That can lead to complications like myocardial infarction, which is a heart attack, or an arrhythmia. Question 7. Which of the following waste items should a medical assistant discard in a red biohazard waste bag? Would this be A, a used suture removal kit, B, syringe and needle used for venipuncture, C, linen soiled with bodily fluids, or D, broken ampules? If you said C, linen soiled with bodily fluids, then you are correct. Red biohazard bags are designated for non-sharp biohazardous waste contaminated with bodily fluids. Linens that are soaked or heavily soiled with blood, urine, or other bodily fluids must be disposed of in a biohazard bag to prevent contamination and also disease transmission. Now, when it comes to any disposable sharps or sharp items, anything that punctures a patient's skin is considered to be a sharp, and it should be disposed of in a sharps container. Question 8. A medical assistant is preparing a patient who has anemia for an examination by the provider. Which of the following manifestations should the assistant expect? A, an irregular heartbeat. B, cloudy vision. C, itchy skin. Or D, abdominal pain. Now, if you said A and a regular heartbeat, then you are correct. Anemia is a condition that's characterized by a deficiency of red blood cells or hemoglobin that leads to decreased oxygen delivery to the tissues. So, when oxygen levels are low, the heart is going to have to work harder to circulate blood. And in turn, this can actually result in an irregular heartbeat, or what we call an arrhythmia. All right, question 9. A medical assistant is measuring a patient's oxygen saturation with a pulse oximeter. Which of the following actions should the assistant take? A. Report a reading of 97% to the provider. B. Wash the site with soap and warm water. C. Instruct the patient to take several deep breaths while the sensor is in place. Or D. Check capillary refill in the patient's finger. If you said D, to check the capillary refill in the patient's finger, then you are correct. The reason the answer would not be A, because a reading of 97 is actually normal. Anything from 95 to 100 is considered to be a normal pulse ox reading, and it is unnecessary to wash the site with soap and water. And we actually do not want our patient to take several deep breaths. We want to gauge where their readings are when they're breathing normally and not forcing in extra oxygen. Now, other factors that can affect the reading of the pulse ox would be dirt, oil, and even nail polish. The sensor does not really pick up on darker nail polish colors. And then again, we know poor circulation can interfere with the accurate pulse. So what we want to do is we want to make sure we warm the site. And this gets that blood flowing so that we can get an accurate reading. All right, you guys, question 10. A medical assistant is drawing 5 blood collection tubes. When should the assistant release the tourniquet? A, after removing the needle. B, after a flash of blood is visible in the hub of the first tube. C, within 1 minute of application. Or D, between 2 and 3 minutes after application. If you said C, within 1 minute of application, then you are correct. A tourniquet should be released within 60 seconds. This is going to prevent complications like hemoconcentration, hemolysis, and then also patient discomfort. If that tourniquet is left on too long, it can actually alter blood test results by increasing the concentration of cells and proteins that are in the blood sample. So again, we do not want to leave that tourniquet on that patient for longer than 60 seconds, no more than 1 minute. Question 11. A medical assistant should complete documentation in a patient's medical record at which of the following times? A, immediately following a procedure. B, prior to a procedure. C, during a procedure. Or D, after completing all procedures for that day. If you said A, immediately following the procedure, then you are correct. Accurate and timely documentation is essential in healthcare to ensure proper patient care, maintain legal compliance, and also prevent errors. Medical assistants should record details immediately after a procedure to capture real-time information while it's still fresh in memory. Delayed documentation can increase the risk of missing important details, misreporting events, or even forgetting key aspects of the procedure. Question 12. A medical assistant is assisting a patient from a wheelchair to an examination table. Which of the following assistive devices should the assistant use to ensure patient safety when transferring? A, a walker. B, a cane. C, crutches. Or D, a gait belt. If you said D, gait belt, then you are correct. Now, a gait belt is also known as a transfer belt. It is a secure and effective assistive device that's used by healthcare professionals to help patients with mobility impairments transfer safely from one position to another. It also provides a secure grip for the medical assistant to hold on to the patient without putting strain on the patient's arms, shoulders, or clothing. Now, the gait belts reduce the risk of fall and injury by offering stability and also support during movement. Question 13. A medical assistant is performing a urine analysis on a patient and identifies the color of the urine as being greenish yellow. Which of the following can contribute to making the urine that color? A, infection, B, blood loss, C, bile duct obstruction, or D, dehydration. If you said C, bile duct obstruction, then you are correct. Now, a greenish yellow discoloration of urine is often linked to bilirubin or bile pigment abnormalities. This can occur due to a bile duct obstruction or even liver disease. Now, your bile ducts are responsible for transporting bile from our liver to our small intestine. And when they become blocked, bilirubin then starts to build up in our bloodstream and it gets excreted in the urine. Elevated bilirubin levels can actually cause the urine to appear dark yellow, brown, or even greenish yellow. This just depends on the severity of the obstruction. Question 14. When entering a new patient appointment, which of the following is an appropriate amount of time to block off? A, 15 minutes, B, 30 minutes, C, 60 minutes, or D, 80 minutes. If you said C, 60 minutes, then you are correct. A new patient appointment typically requires more time than a follow-up or an established patient visit would. 60 minutes is the standard time allocation for new patient visits. This allows for a comprehensive medical history review, discussion of current health concerns, and also for the initial examination. Now, on the exam, you guys may see the range being from 45 to 60 minutes for a new patient appointment. And this is pretty common and standard among healthcare facilities. Sometimes physicians will choose to customize the time based on their practice and their need. But across the board, we do see them about 45 to 60 minutes for those new patient appointments. Now, when coaching a patient, question 15, when coaching a patient, which of the following is an example of disease prevention? A, providing hands-on instruction about how to check a blood glucose level at home. B, providing instructions about effective hand washing. C, providing a patient with information about annual diabetic eye exams. Or D, providing an instructional video based on the patient's home health care and follow-up appointments. Now, I want you guys to pay attention to the wording of the question. They're asking you to give an example of disease prevention. So when looking at our options out of the 4 provided, which one do you think is more focusing on disease or disease prevention? If you said B, providing instructions about effective hand washing, then you are correct. Disease prevention involves actions that reduce the risk of illness or injury. Hand washing is a primary method of preventing infections by removing germs that cause illness. A question that you guys may see on your exam: what is the number one way to break the chain of infection? It is going to be to wash your hands. Good job. All right, you guys, question 16. When performing a prior authorization for durable medical equipment, also known as DME, for a patient with Medicare, a medical assistant should understand that which of the following Medicare plans covers DME services? Is it A, Part A, B, Part B, C, Part C, or D, Part D? If you said Part B, then you are correct. correct. Now, Part B covers durable medical equipment. Again, this is also known as DME. And these are devices like wheelchairs, walkers, oxygen equipment, and also prosthetic devices. Part B also covers outpatient services, preventative care, and even some home health services. Question 17. Which of the following is the lay term that can be used in the place of the medical term varicose? Is it A, hives, B, scabies, C, lice, or D, warts? If you said D, warts, then again, you are correct. The term varicose is the medical term for wart. Warts are benign, and remember, benign means non-cancerous. If you guys were to see the term malignant, malignant means cancerous. Benign means non-cancerous. So warts are benign skin growths that are caused by the human papillomavirus, also known as HPV. Warts are commonly found on the hands, the feet, and even other areas of the body. Question 18. What is the surgery that destroys cancer cells by freezing them with a substance such as liquid nitrogen? Is this A, radiation therapy, B, cryosurgery, C, chemotherapy, or D, laser surgery? If you said B, cryosurgery, then you are correct. Cryosurgery is a medical procedure that destroys abnormal or cancerous cells by freezing them by using extremely cold substances like liquid nitrogen or even argon gas. Could not get that out for a second. The method is commonly used for skin cancers, cervical precancerous lesions, and also some prostate cancers. The extreme cold causes cellular damage that leads to necrosis. So when you hear the term necrosis, this is cell death. Now, this prevents the cancer cells from being able to multiply. Question 19. Which of the following is an example of a sterile procedure? A, cleaning a wound with soap and water. B, administering oral medication. C, inserting a urinary catheter. Or D, applying a bandage. If you said C, inserting a urinary catheter, then you are correct. A urinary catheter insertion requires a sterile technique because remember that catheter enters the bladder through the urethra, which has to maintain free of infection. Sterile gloves, drapes, and a sterile catheter are used to prevent contamination and also reduce the risk of UTIs, which are urinary tract infections. Now, as medical assistants, it is not in your scope of practice to insert catheters into your patients, but you guys still may see this referenced on your certified clinical medical assistant exam. Question 20. In Erik Erikson's stages of psychosocial development, which of the following stages is associated with an adolescent needing privacy and providing some independence? Is this going to be A, identity versus role confusion, B, trust versus mistrust, C, intimacy versus isolation, or D, initiative versus guilt? If you said A, identity versus role confusion, then you are correct. This stage occurs during adolescence, between the ages of 12 and 18 years old. Now, during this time, teenagers start exploring their sense of self, their personal identity, and also their independence. Privacy and autonomy become crucial as adolescents seek to establish their own identity. Question 21. When assisting a provider with a punch biopsy of a mole, which of the following tasks should a medical assistant anticipate? A, receive and prepare the tissue specimen for processing. B, swab fluids from the biopsy site. C, retract the edges of the biopsy site. Or D, place sutures at the incision site. Now, if you said A, to receive and prepare tissue specimens for processing, then you are absolutely correct. A punch biopsy is a minor surgical procedure that's used to extract a small circular sample of skin for diagnostic purposes. We utilize this to check for cancer or abnormal cells. Now, the medical assistant's role is to handle the biopsy specimen, ensuring that it's properly labeled, that it's preserved, and that it's also sent to pathology for examination. Medical assistants do not perform any invasive procedures, but do assist with specimen handling, patient care, as well as documentation. Question 22. A patient who has an acute illness calls to schedule an appointment. According to best practices, in which of the following time frames should the patient's appointment be scheduled for? Would it be A, within an hour, B, the same day, C, within the next week, or D, the following clinical day? If you said B, the same day, then you are correct. Now, acute illnesses, these are what we consider to be sudden onset medical conditions that require timely evaluation to prevent complications. Best scheduling practices are going to be to prioritize same-day appointments for those patients who do have acute conditions like fever, infections, vomiting, or even worsening symptoms of a chronic disease. Question 23. A medical assistant is caring for a child who has varicella-zoster virus. The assistant should recognize that varicella is spread through which of the following modes of transmission? Is it A, airborne, B, bloodborne, C, vector-borne, or D, foodborne? If you said A, airborne, then you are correct. Now, the varicella-zoster virus is known as chickenpox, and it's primarily transmitted through airborne droplets. When an infected person coughs, or when they sneeze, or when they talk, it is now being spread airborne. It can also be spread through direct contact with fluid from vesicles, like skin lesions, of an infected person. Now, it's not considered a bloodborne transmission because bloodborne transmissions occur through infected blood or bodily fluids. For example, hepatitis, HIV. Now, vector-borne transmissions, these involve disease spread through insects like mosquitoes or ticks. A person gets bit by a mosquito, they develop malaria. A person gets bit by a tick and they may get Lyme disease. This does not apply to chickenpox. And then foodborne transmissions occur when pathogens are ingested through contaminated food or water. Question 24. Which of the following is a formal authorization that identifies an individual as legally able to make decisions on behalf of a patient? Would this be A, a durable power of attorney, B, a do not resuscitate order, also known as a DNR, C, a uniform donor card, or D, a physician-patient contract? Now, if you said A, a durable power of attorney, then you are correct. A durable power of attorney for healthcare is a legal document that grants a designated individual, known as the healthcare proxy, the authority to make medical decisions on behalf of a patient if they become unable to do so themselves. This document ensures that medical and healthcare decisions align with the patient's wishes when they are unable to make decisions on their own. Now, we're talking about a DNR, a do not resuscitate order. This is a medical order that instructs healthcare providers to not perform CPR if the patient's breathing or their heart stops. A uniform donor card, this indicates a person's wish to donate their organs after death, but does not authorize medical decision-making on behalf of the patient. And a physician-patient contract, this is basically an agreement outlining terms of care between a physician and the patient. But again, this does not grant formal authorization for decision-making. A patient who has night blindness might be experiencing which of the following vitamin deficiencies? And this is question 25. Is it A, vitamin D, B, vitamin E, C, vitamin A, or D, vitamin K? Now, if you said A, vitamin K, then you are correct. Night blindness is a condition where a person has difficulty seeing in low light or dark environments. This is commonly associated with the deficiency of vitamin A, which is an essential for the production of a pigment in the retina that does help with low light vision. Now, vitamin D is essential for bone health and also calcium absorption, but it actually does not affect the vision. Vitamin E is really important for neurological function as well as skin health. But again, it is not linked to night blindness. And vitamin K is a necessary vitamin for blood clotting, but it has no role in our vision. Question 26. A provider asks a medical assistant to assist with an orthopedic examination. Which of the following instruments should the assistant prepare for the examination? Would it be A, a tonometer, B, a hemostat, C, a retractor, or D, a goniometer? See what you guys get. If you said D, goniometer, then you are 100% correct. Now, this instrument is specialized in measuring the angle of joint movements that make it essential for orthopedic assessments. Good job, you guys. Question 27. When discharging a patient from a minor surgery, which of the following findings should a medical assistant instruct the patient to recognize as expected part of the recovery process? A, a temperature reading of 100.5 degrees Fahrenheit. B, slight discomfort at the surgery site. C, continuous bleeding from the wound. Or D, red streaks near the wound. If you said B, slight discomfort at the surgery site, then you are correct. After minor surgery, it is normal, perfectly normal, for a patient to experience mild discomfort, swelling, and even tenderness at the surgical site as part of the healing process. Question 28. Which of the following is an example of an involuntary movement by the patient that can lead to a somatic tremor artifact on a patient's EKG? Would it be A, chewing gum, B, supporting arms with the adjacent table, C, shivering due to coldness, or D, talking to the assistant? If you said C, shivering due to coldness, then you are correct. Now, a somatic tremor artifact on an EKG is caused by muscle movement, and this is often involuntary, and this can actually create electrical interference with the test. So shivering due to cold or conditions like Parkinson's can cause repeated muscle contractions that can lead to excessive artifact interference. For some of you that are testing, you may have a question based around a somatic tremor, and they're going to ask you, what do you do in the event of a somatic tremor? Give the patient a blanket. A medical assistant receives a prescription to administer an intramuscular injection to a patient. Which of the following angles should the assistant use to administer the injection? Would it be 10 degrees, 15 degrees, 45 degrees, or 90 degrees? Remember, we are referencing an intramuscular injection. And thank you guys so much for hanging in with me today. I am feeling a bit under the weather, so my voice may sound a little cracky and going in and out here. But if you said D, 90 degrees, then you are absolutely correct. When we're thinking of intramuscular injections, think of shooting a dart. You are going straight in. There is no angle. There's no lean to that needle. Going straight in, just like shooting a dart. Now, intramuscular injections, again, administered at a 90-degree angle to ensure that the medication reaches the muscle tissue rather than the subcutaneous layer. Now, remember that subcutaneous layer is also known as adipose tissue. That is the fatty layer. The needle penetrates through the skin and the subcutaneous fat directly into the muscle, and this does allow for rapid absorption of the medication. Common IM injection sites will be like the deltoid muscle, the vastus lateralis, and also the ventrogluteal. All right, question 30. A patient receives a referral to an oncologist. Which of the following types of office visits is this considered? Would it be A, an established patient, B, an inpatient visit, C, a consultation office, or D, a surgical visit? If you said C, consultation office, then you are correct. Now, a consultation office visit is when a specialist, like an oncologist, evaluates a patient at the request of another provider, usually by like a primary care physician, family med. Now, they do this to assess, diagnose, or manage a patient's condition. In this case, the referral to an oncologist suggests that the patient is being sent for a specialist's evaluation and opinion on a potential cancer diagnosis or treatment plan. Question 31. Which of the following should the medical assistant obtain from an insurance company prior to performing an outpatient surgery? Would it be A, a remittance advice, B, a referral, C, a pre-authorization, or D, an explanation of benefits? If you said C, pre-authorization, then you are correct. Pre-authorizations are also known as prior authorizations or even pre-certifications. This is a requirement by many insurance companies before they will approve coverage for certain medical procedures. This even includes outpatient surgeries. Now, it involves obtaining approval from an insurance provider to ensure that the procedure is medically necessary and covered under the patient's policy. If a pre-authorization is not obtained, then the insurance company may deny payment, and this would leave the patient responsible for the full cost. Question 32. A patient has been diagnosed with anemia. Which of the following laboratory tests should the medical assistant anticipate to confirm this diagnosis? A, RBC, B, glucose, C, BUN, or D, calcium? If you said A, RBC, then you are again correct. Anemia, again, is a condition that is characterized by a deficiency in the number or quality of red blood cells. These are also known as RBCs or hemoglobin, which reduces the blood's ability to be able to carry oxygen. An RBC count is one of the primary tests that's used to diagnose and evaluate anemia. Other related tests like hemoglobin and hematocrit levels may also be ordered to further assess the severity of the anemia. Question 33. Which of the following information should a medical assistant document in the chart after administering an injection to a patient? Would it be A, the site of the administration, B, site of the syringe, D, gauge of the needle? Oh, I said that incorrectly. I'm sorry. A, site of administration, B, site of the syringe, C, the gauge of the needle, or D, the doses remaining in the vial. Again, which of the following information should a medical assistant document in the chart after administering an injection to a patient? If you said A, the site of administration, then you are correct. After administering an injection, the site of administration should be documented in the patient's chart. This information is essential for accurate medical records, helps monitor for potential side effects at the injection site, and also prevents repeated injections in the same location, which can reduce the risk of tissue irritation. Question 34. Almost made it to the end, guys. When performing venipuncture, how many inches above the site should the medical assistant place the tourniquet? Would it be A, 2 inches, B, 1 inch, C, 4 inches, or 5? D, 5 inches. If you said C, 4 inches, then you are absolutely correct. Now, the tourniquet should be placed 3 to 4 inches above the venipuncture site to adequately restrict venous blood flow and make the veins more prominent without causing discomfort or excessive pressure that could affect the blood samples. The positioning allows for an effective and safe venipuncture procedure. All right, you guys, number 35, our very last question. The timing for a glucose tolerance test. This test is also known as a GTT test. When does it begin? Is it A, when the patient finishes drinking the glucose solution? B, when the test results are completed on the fasting sample? C, 30 minutes after the patient finishes drinking the glucose solution? Or D, when the fasting sample is drawn? If you said A, when the patient finishes drinking the glucose solution, then you are 100% correct. The timing for a glucose tolerance test, again, GTT, this begins immediately after the patient finishes drinking the glucose solution. The timing is crucial because blood samples are drawn at specific intervals, like 30 minutes, 1 hour, 2 hours. And the purpose of this is to measure how the body does process glucose over time. You guys did a really, really, really great review today. I'm very proud. This is a wrap on today's CCMA review. I really, truly hope that you guys did find these questions and rationales a bit helpful and that it's leading you to start feeling a little bit more confident for your exam. Remember, understanding why an answer is correct is just as important as memorizing it. If you enjoyed the video, please don't forget to give it a thumbs up. It really helps support the channel. And if you're serious about passing the CCMA exam, go ahead and hit that subscribe button. Not only am I going to be doing questions and answers with rationales, but I'm also going to break down certain modules and certain areas of study that you guys should know, whether it's infection control, EKG, phlebotomy, patient care, medical law and ethics. So I'm going to cover quite a few topics for you guys as well. And also, don't forget, let me know in the comments how many questions you've got right and which topics you want me to cover next. I really and truly love hearing from you and helping you on your journey to becoming a certified clinical medical assistant. Sorry for the raspy voice, you guys. These allergies and sinuses have been a doozy for me this week. I know we have weather changing and it's warming up a bit. So thank you guys for hanging in there with me. Don't forget to drop a comment. Please remember to subscribe and hit that bell so you don't miss a study session. And remember, study smart, stay confident, and let's go ahead and get you certified.